My name is Kathy. I'm the Education Director for the DPC Education Center. And welcome to our March webinar on what the COVID-19 means for kidney patients. Before we get started, just a couple of reminders. All of your lines should be muted. At the end of the program, you can unmute your phone and then mute it again to ask any questions, or you can ask questions in the chat box. And the recording will be available as well as the slides. At the end of the program, we have a feedback form that we hope that you will complete. Give us feedback for this program and any other future programs that you would like to see. I am so happy that we can offer this topic for you today. It's in the news, it's very important, it's ever-changing, and definitely it's a topic that kidney patients need to know about. And so we have two experts in the field with us today. Our first speaker will be Shannon Novosad. She is a physician, the medical director with the Dialysis Safety Team in the Division of Healthcare Quality Promotion, known as DHQP, at the Centers for Disease Control and Prevention. Dr. Novosad received her medical degree from the University of Alabama at Birmingham. In 2015, she came to CDC as an Epidemic Intelligence Service Officer assigned to DHQP, where she investigated outbreaks in healthcare settings. Her areas of concentration include prevention of central line-associated bloodstream infections and increasing the safety of patients on dialysis. Our second speaker is Alan Kliger, also a physician, who is the clinical professor of medicine at Yale University School of Medicine. He's a member of the Standing Renal Committee for the National Quality Forum and chairs the Nephrologist Transforming Dialysis Safety Initiative. It's a national partnership between the CDC and the American Society of Nephrology. He served formerly as Senior Vice President, Medical Affairs, Chief Quality Officer, Yale New Haven Health System, and Senior Vice President, Chief Medical Officer, Hospital of St. Raphael, New Haven, Connecticut. He is the past president of the Renal Physicians Association and serves on its Quality, Safety, and Accountability Committee. He is the past president of the Forum of ESRD Networks. He served as chair of the steering committee for the NIH Frequent Hemodialysis Study, a national prospective randomized of in-center daily and home nocturnal hemodialysis, and currently chairs the steering committee for an NIH-NIDDK consortium on novel therapies for hemodialysis patients. It's my pleasure to turn the program over to them, and Shannon, would like for you to start, please.
Great, thanks so much. Thanks everyone for calling in today and being willing to have me speak with you. I'm happy to start passing along some information to you guys, and are really interested. Hopefully we'll have time at the end to hear what your questions are. I think, as everyone on the phone probably knows, this is definitely an emerging situation. We're still learning new stuff every day. And based on that, we adapt, the measures we think are needed to keep everyone safe. So I think just kind of keeping it in the back of your mind that stuff we're talking about today could change even tomorrow. So thinking of ways that you're going to stay up to date and learn new information as it comes out, I think is key. We definitely are working on ways to, as soon as we learn something and something important changes for you and what you might need to do to stay safe, to get those messages out to you, and we'll continue to work on those. But again, there may be some questions you ask at the end we don't have answers to, but those are still really important questions that we want to hear, because that helps us know what we need to be working on and things that we need to be trying to find answers to help everyone. So today I have a couple of things I want to do. So one, I want to just describe COVID-19. I'm not going to go into a lot of detail on this. I know Alan's going to talk some more about this, but I just wanted to hit some high points here. We want to review what patients can do to protect themselves from respiratory infections, and this includes, respiratory infections in general and COVID-19, because a lot of the things are the same. And then go through some of the high points of CDC's recommendations for outpatient hemodialysis facilities. We want, everyone to know that these recommendations exist and were put out this week, and, we have already done a lot of messaging with dialysis facilities to get the word out. We also think it's important for patients to know some of the information that's included here so they can know what they should expect to be seeing at their dialysis facilities, and if they're not seeing that, to know what to ask about. So in terms of what is COVID-19, so this is just kind of a little schematic on this slide, just showing you what it stands for and how the name was derived. So you can see the CO stands for corona, VI for virus, D for disease, and then 19 refers to 2019, so the year when it was first identified. So that's where the name that you're hearing, all over the news now, that's where it came from. But what is it? So it's a respiratory illness, again, caused by a type of virus called coronavirus. So you'll hear a lot of people say coronavirus or COVID-19. Probably generally in today's age, they're talking about, the same thing, but in reality, coronavirus is really a group of viruses. So just kind of, some of them even can cause, what we think of as a common cold, but, more severe diseases such as COVID-19. So again, just kind of knowing the differentiation when you hear those terms. But specifically, COVID-19 is a novel or new coronavirus that was first discovered in China. And then on January 31st, just kind of thinking through what's going on in the U.S., that was when it was first declared a public health emergency by Secretary Azar. And how does COVID-19 spread? I think, caveat, it's a new disease and we're still learning how it spreads, but we think it's mainly person to person and between people who are in close contact with one another. And when we think of close contact in this setting, we're really thinking about 6 feet. And 6 feet comes from the distance that respiratory droplets, can travel. And respiratory droplets are released when a person, coughs or sneezes. So again, we think this is kind of the main way the disease is spread. In addition, it may be possible to get COVID-19 by touching surfaces and then touching your mouth, nose, or eyes. So, when a person, coughs or sneezes, these droplets, may settle on a surface or an object. So again, when you hear, all the talk about hand hygiene and not touching your face, which I'm going to talk some about, this is what we're thinking about there. And signs and symptoms, again, this is another area we're still learning a lot about, but we think right now that it takes between 2 and 14 days for symptoms to start after a person has been exposed. Some of the more common symptoms that we've seen are fever, cough, sore throat, shortness of breath, muscle aches, and fatigue. But less common symptoms such as headache and diarrhea have also been seen in patients. And also, I think important to know that the initial symptoms could be mild and fever might be absent. And again, we are still learning what this disease might look like in different people. So for example, patients on dialysis, do they have the same symptoms as others? It's something we're kind of actively exploring and trying to learn. So who's at risk for getting very sick from COVID-19? This is also something you're probably hearing about in the news and also something we're trying to better understand. We do think that there are some people that are at higher risk of getting sick. These include older adults, so perhaps greater than 60, but again, I think we're trying to understand what the age cutoff there might be. And also people who have chronic medical conditions like heart disease, diabetes, and lung diseases. Many patients on dialysis may be older or have other medical conditions that put them at a very high risk of becoming sick. And as you know, chronic kidney disease is a chronic medical condition. So again, we think it's very important, for this patient group to really understand the warning signs and symptoms of COVID-19. And then knowing as a dialysis patient, it's really important for you to take actions to prevent yourself from getting COVID-19. That's what we're going to talk about now. And so these are actions that you can take both outside and inside the dialysis facility. This slide initially said take action outside the dialysis facility, but then we started thinking about it a little bit more, and some of these are things you really need to be watching for when you're inside the facility too, so just kind of wanted to reiterate that. So first is hand hygiene, it sounds easy, but in reality, doing hand hygiene appropriately isn't that easy because it takes a lot more time than you think it might. So it can include washing your hands with soap and water for at least 20 seconds. So really thinking through, are you doing it long enough when you wash your hands? If soap and water are not available, using a hand sanitizer that contains at least 60% alcohol. And again, doing this frequently and, after certain activities. So this isn't an exhaustive list, but, sometimes when you definitely want to be cleaning your hands, include after blowing your nose, coughing or sneezing, after being in public places, and after touching surfaces in public places. So just to kind of list a few. I would say if you're wondering if you should be washing your hands or cleaning your hands, you should be doing it. Respiratory hygiene, so this is like kind of a blanket term we use for a lot of things. But the main thing is covering your coughs or sneezes, when they happen. So best way is with a tissue, which you can then throw in the trash. So keeping tissue handy is, something important to be doing right now, and also your dialysis facility should be having it readily available for you. But if a tissue is not immediately available, coughing or sneezing into your elbow is another option. But again, immediately cleaning your hands and then disposing of the tissue in the appropriate place. Cleaning and disinfecting surfaces. So your dialysis facility should be doing this, in the facility for you, but it's also important to think of doing this at home. So really practicing routine cleaning of frequently touched surfaces, such as tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, and cell phones, I think just to name a few, and following the instructions on disinfecting wipes. So I think about this similarly to how I think about hand hygiene. You may be using the wipe, but if you're not doing it appropriately, it's probably not really helping you that much. So knowing what you're using to clean and knowing the amount of time that the surface must stay wet with a solution in order to properly disinfect the area is really important. So actually paying attention to what it says on those instruction labels for cleaning products. There are also some things to avoid. This includes, as I said earlier, touching your face, your nose, and your eyes, avoiding crowds as much as possible. Obviously, all crowds can't be avoided. There's certain activities that will be happening in places with other people, but especially in poorly ventilated spaces, thinking about it. And again, as much as possible, avoid handling high-touch surfaces in public places. Again, not all of these are going to be possible to avoid, but when you're thinking about high-touch surfaces, some of these could include elevator buttons, door handles, handrails, handshaking with people, which is a very hard habit to break, but, things, you could think about your elbow bumps or other things. This might be a great time for us to all start instituting some creative measures. Are you using a tissue or your sleeve to cover your hand if you much touch something is something also to think about. But again, if you're touching surfaces, we're all going to be touching surfaces. There's no way to get around it. So, all of the other things we've already mentioned, such as hand hygiene, are key. And doing as much as possible, to avoid touching your eyes, nose, and mouth. I'm pretty sure I've touched my face 3 times since I started talking, so definitely something we can all work on. Other considerations. Really just everyday precautions to keep space between yourself and others, and that will be different for different people depending on what your everyday life looks like. When you go out in public, keeping away from others who are sick, limiting close contact and washing your hands often, and thinking about avoiding, some activities that, you may even already have planned, such as cruise travel and non-essential air travel are all things we should be thinking about how to incorporate into our daily lives. So also not as much fun to think about, but having a plan in place if you get sick is something we all need to be thinking about. And this involves talking with your family and caregivers to determine, what plan works best for you. Thinking about how you would stay in touch with others, by phone or email, because you may not be able to see everyone in person. If you're sick, you may need to ask for help from friends or family, and I know that's difficult for a lot of us to do, but thinking about, who are those people that you would ask for or can rely on for help. Knowing important contacts and having phone numbers for your dialysis facility, other medical providers such as your primary care provider, if you have a caregiver or other provider, being able to get in touch with them. So you really don't want to wait until you're feeling sick or something's happening to have to rush around and try to find this contact information. So just getting it ready and having it, in one place for easy access, programming it in your cell phone if you don't already have it there, on a Post-it note by a phone for a landline, and magnet on the refrigerator, various places. And if you have a caregiver, important to start thinking about who can provide you with care if that caregiver becomes sick. So again, all part of the planning process. And then just making sure we have access to several weeks of medications and, other supplies that you might need. And that might involve, conversations with your medical provider on what are essentials, and, working with insurance companies and others to figure out how that's going to be done. I do know for some Medicare stuff that there has been some work about prescription refills, and I believe that I was told today they have some information that might start to be posted on their website about that. So that might be a place to start looking as well to see if that helps you with your planning. And then if COVID-19 is spreading in your community, you might start to receive a lot more information than what we went over, which I think is more general and applies to all of us now, really. But I think one of the main things you can do is to remain alert from notices, from your local public health authorities, because they're going to be the best experts to tell you what's happening in your local area and, specific measures you might need to be taking in your area to stay safe. This might include specific events that may be canceled in your area and really a variety of things. But I think importantly, what we want to reiterate is that you shouldn't postpone your dialysis treatment. So your facilities are all working and planning now on how they can provide you dialysis safely. So while you're doing all of your planning, I don't want the plan ever to be in there to miss dialysis. So I think we all need to make sure we keep that in the forefront. And if you feel sick or think you may have been exposed, definitely let your dialysis clinic know, let your primary care provider know, especially what your symptoms might be. This is going to help them take care of you and make proper preparations for your dialysis treatments. And in particular, important to know, when to get emergency help. So there's always a difference between when can you call the clinic versus when you need to call 911. So this isn't a full list of emergency warning signs, but just if some of these things are happening, you need to seek help immediately. These include, difficulty breathing or shortness of breath, persistent pain or pressure in your chest, confusion or inability to really get up, feeling very tired, or, bluish lips or face, which may indicate, a person's not getting enough oxygen. And so to switch gears a little bit, I'm going to talk about some of our recommendations for dialysis facilities now. And the reason I wanted to go over that on this call is because I want patients to know the kind of things they might start seeing in their dialysis facility. And I want them to feel comfortable that if they're not seeing these things, to really be able to speak up and ask, if they're planning to start doing these things or why they're not seeing them. And so we do have guidance on our website for dialysis facilities. I think it's written for healthcare, personnel and dialysis clinics, but I also think it's great for patients to take a look at these things and understand what's out there. And it really, I think, can inform questions they might want to ask, or again, make them understand why they're seeing, certain things they're seeing in their facilities. And so you should start seeing more education and training. So all staff and patients should be educated about the importance of hand hygiene, respiratory hygiene, and cough etiquette. And you should know that you may not see some of your staff around. Staff really should not be reporting to work if they are ill. Sorry about that, guys. I think I lost some internet connection there. I think I'm back. Sorry. So again, you may not see your normal staff member, your normal dialysis tech. There may be someone different there, but they're not there because they don't want to be there. They're not there because they want to keep, you guys safe, and they want to keep all the other, workers at the dialysis clinic safe. Your staff should be trained about proper use of personal protective equipment, or PPE. And when we talk about PPE, we mean all the things that you see, healthcare providers wearing, such as masks and gloves and eye protection. That's all in efforts to keep them safe and to prevent them from spreading, disease between patients. And there should be education on the signs and symptoms of COVID-19 and when to contact the local health department for support. And we say here on the staff, but again, also you as patients should be getting education on the signs and symptoms of COVID-19. So, there's a lot of information in the news, and as I said, we're learning more every day. But I think it's key for your providers and for your dialysis facilities to make sure that the most important and accurate information is getting relayed to you all, and updating you as frequently as needs to be done for that. You might see some changes in the waiting areas. So you may see signs at clinic entrances with instructions for patients with fever or symptoms of respiratory infection to alert staff. This is, so they can take appropriate precautions to keep you and everyone else safe. So if you show up and you're having symptoms, they're going to hand you a mask to put on right away and to wear the whole time that you're in the dialysis clinic. There should be space in the waiting areas for patients with symptoms to sit separated from other patients. And you may see them ask patients who have symptoms if they're well and, able to actually sit outside, maybe on a bench and wait or in a car and wait. Again, this is all in efforts, to keep kind of that 6 feet of distance between patients that we mentioned earlier. You should have tissues, alcohol-based hand rub, and trash cans, should be provided and in multiple locations so that you can do all of the hand hygiene as needed and all of the respiratory hygiene that we talked about. And again, you may see more signs, again, this time with information, about hand hygiene, respiratory hygiene, and cough etiquette. So planning for arrival. So your facility should have a plan in place to identify if you have a fever or symptoms of a respiratory infection before you enter the treatment area. So you might be getting told by your dialysis facility to call ahead and report if you have symptoms. And it's really important that you do. It helps them plan for your arrival. So think about, where you're going to get dialysis that day, make sure they have a mask for you. Or it helps them decide if you're sick enough that you may need to go to the hospital. So again, deciding where's the safest place for you to go. And you should be, again, in addition to calling ahead, you should also be asked about fever or respiratory symptoms when you arrive. And again, very important that if you're having any of these symptoms that you let staff know right away. And then for treatments, if you're having symptoms or you're ill, ideally they'd be able to do your treatment in a separate room with the door closed. This is possible at some dialysis facilities, but not all dialysis facilities. So if that's not the case, you may be moved to a corner or an end of the row station, kind of away from the main flow of traffic. But you should definitely be separated by at least 6 feet from the nearest patient if you're having symptoms. And also know that the routine cleaning and disinfection procedures that staff currently perform, are appropriate for COVID-19 in the dialysis setting. So, they should continue their normal procedures for that. The thing that you might see different is that any surfaces, supplies, or equipment located within 6 feet of an ill patient should be disinfected or discarded. So you may see more cleaning in terms of along those lines, or perhaps stuff in the waiting room like magazines and stuff that can't be cleaned might have to be thrown away. So kind of based on all of that, some things that you might notice. You might notice a change in your treatment time or day. Depending on your facility setup, staff may need to change your schedule to make sure you're receiving the safest possible care. That includes, even if you're not having symptoms, they may have to move patients around who are having symptoms maybe all to the same session, for example, so they may ask you to come at another time or vice versa. You may notice a change in your chair as the facility may rearrange stations to keep you safe. You may notice a change in the personal protective equipment that the staff wear, so they may be wearing additional or special gowns, as well as face masks during high-risk times. And facilities may ask you to wear a face mask for your entire treatment, so from the time you enter the building to the time you leave. But again, I want everyone to know that you should be speaking up during this time. Don't be afraid to use your voice. It's really okay to ask staff questions. And again, there's probably many more questions than are on this list, but some that we thought of are asking your clinic what they're doing to prepare for COVID-19, asking them how these changes would affect your treatment, asking them what you can do to protect yourself and others. And if you don't see them performing hand hygiene, you could ask them, or if you're not sure if they did it or you don't know if they did it long enough, do you mind cleaning your hands again before you care for me? And then just, so this is not an exhaustive list of resources by any means. There's a lot of resources on the CDC website, and it's, updated daily as information becomes available. But just a few, website resources that you might be interested in checking out. They include at the top the situational summary. This is updated very frequently and includes updates on the number of cases in the United States and, locations of cases and a variety of other information that changes frequently. There is development of a page for people at risk for serious illness. So again, some of the groups that I mentioned, and we update this as we learn more, but gives some more detailed recommendations on people who are likely to get more ill with COVID-19 and how they can keep themselves safe. Information on presenting spread in the communities. So again, I think goes into more detail, some of the stuff that we discussed. There's some videos, and then there are some print resources and fact sheets as well. And again, just to reiterate, this will all continue to change as we learn more. So I think checking all of these areas frequently and other areas you would find on the website would be a good way to stay up to date on that information. And that's all I have now, so I'll hand it over to Alan.
Hi, everybody. Help me get my slides up. Shannon did a really lovely job at talking about the things that you should look for and the things that you should think about with this infectious outbreak. I'm going to go over lots of the same sorts of things. There'll be some new, but a lot of emphasis of what Shannon just talked about. And then we really look forward to your questions at the end. So as Shannon mentioned, coronaviruses are a large family of viruses that are very common in people. They're also common in animals, including animals like camels, cattle, cats, and bats. The particular type of virus that causes COVID-19 is called SARS-CoV-2. It's a coronavirus which is really similar to the SARS virus that you may have heard about years ago. First breaking out in Wuhan in Hubei province in China, and then really moving around the world, as you've all known. It is interesting that the genetic code of this virus has been cracked, and it looks an awful lot like the virus that infects bats, a SARS-like coronavirus that affects bats. So the current thinking is that it's likely that this new coronavirus started with a bat to human infection and since then has been spreading in humans. So, one of the first things that my patients have asked me is really, how do you compare the contagion, how contagious is COVID-19 compared to other types of infections? This graphic that you see here was published in Popular Science a couple of weeks ago and compares the spread of COVID-19 to other viral diseases. If you look in the middle, you'll see a graph of the contagion of SARS. And you may remember SARS from years ago, which was a very serious viral illness. The yellow circle in the middle shows one sick person. The dots around him show how many people will catch the disease. In this case, for every 20 people exposed to the SARS infection, 3 or 4 people become infected, the red dots. If you look, for example, in the bottom right, you'll see what happens with measles. Any of you as old as I am remember measles as a remarkably infectious disease, very contagious. And you see here, for any one person that's infected, 75% of exposed people catch the disease. Okay, so now let's look at COVID-19 in the left column in the middle row. What you see there is that 2 to 3 out of 20 people will catch the disease. If you look right above, in the top line, you see common flu or influenza. So comparing these, you see that COVID-19 is more catchy than influenza is, more likely to get infections compared to influenza, but not nearly as catchy as was measles or rubella or smallpox. And as Shannon said, the virus generally is spread when a person with the infection coughs or sneezes. But in this case, coughs is the commonest way for COVID-19. Millions of virus particles on droplets of fluid are aerosolized into the air. Now, if you take a picture with certain light of somebody that's coughing, here's what it looks like. All those droplets coming from that person can be infected with the viral particles. Now, what happens to those droplets? Well, obviously, they follow the rules of gravity. So they then settle down, and they settle down in the distance from the person that you see, which often can go out to almost 6 feet. And they settle in all the surfaces and areas around them or on people that are that close to the person who coughs. When they land on surfaces, other people then touch these surfaces and carry the virus particles to their mouth, eyes, and ears when all of us touch our faces. The viral particles, when they get into the body through the mouth or through the nose or through the eyes, you know, with the eyes, you might say, my God, how does that happen? Well, it happens because the fluid in around your eyeball drains back into your throat. And so all of those fluids drain down, viral particles travel to the lungs where they set up housekeeping and cause infection. You know, on this picture that you see to the left here, it shows what someone with a common cold looks like. And you notice they have a nose that has dripping nose. The dripping nose, the nose that is sniffling, is not a common symptom in COVID-19. So that people with no fever or a low-grade fever and the sniffles and the sneezes without too much of a cough and no other symptoms are more likely not to have COVID-19 infection, are more likely to have a common cold or some other viral infection. But when this COVID-19 has been studied, it doesn't only spread with the droplets. The other possible transmission sources are direct contact. And I don't know about you guys, I actually love shaking hands, hugging people. I like touching people. And I've had to learn really carefully that we need to stop doing that while there is an epidemic of COVID-19. Also has been demonstrated some fecal spread, meaning bowel movements contain the virus, and if tiny amounts of that are then in the environment, that can spread the infection as well. The symptoms of this particular virus may appear 2 to 14 days after exposure, commonly in those first 2 to 5 days, but can be as long as 14 days later. Some people have mild symptoms or no symptoms at all. Most patients have fever and cough. In one study that was done, 98% of patients had fever and 60% of patients presented with a cough. Some patients also have fatigue and muscle aches, kind of the flu-like illness that has been described for so many years. The important thing to remember is that most patients recover from this infection with no complications at all. This is not the Black Plague. This is an illness that the vast majority of us, if we get it, will live through and have no substantial complications. But I am going to be talking a bit about those very few people who might get complications and how important it is to think about that and learn how to prepare for that. Those very few patients, 2 to 3% currently, the data suggests, of infected patients may get much more severe disease, including severe pneumonia, where the virus spreads in the bloodstream and it goes all over the body and can affect many organs. That pneumonia can be very severe and cause lung failure or acute respiratory failure. It even can cause kidney failure. Now, that number of 2 to 3% is probably an overstatement of how infectious this disease, or how lethal this disease, rather, really is. The reason that that's likely an overstatement is that in these early phases, the first weeks now of us understanding this infection, we do know most of the people who get very sick or die. But we don't know all of the people who might have had some infection and had no symptoms or had very mild symptoms and might not even have known themselves that they had this infection. So when you know everyone who had a bad outcome, which is the numerator of the fraction, but you don't know the number of people who were infected, the denominator of the fraction, it is likely that when we really learn all that there is to know about this virus, this 2 to 3% of infected patients likely will be much lower than that. And how does that compare to other viral illnesses? This just shows you the death rate, the percent of people who die compared to other viruses. And I said that this COVID-19 currently has a 2 to 3% mortality rate, which I think will be much lower. SARS, that infection you heard about years ago, had a mortality rate of almost 10%. And MERS, the Mideastern Respiratory Syndrome virus, a third of people who got that one died. So these were diseases that have a much, much higher complication rate than the COVID-19 currently has. Recent influenza pandemics, it was 0.1%, or 1 out of 1,000 people die as a complication of that. And the swine flu, those of you who remember that, the H1N1 flu, it was 2 out of 1,000, 2 out of 10,000, sorry, much, much lower rate. So yes, there are some of us who will have serious complications. Currently, it looks to be 2 to 3%. It likely will be closer to 1%. But we have to take this very seriously and pay careful attention to it. So who's at highest risk of those bad complications? Children appear to be at very low risk of complications. Kids likely are just as likely as adults to get the infection, so it's not that they're immune to it. The children are just as likely to get this infection as adults. But children appear to be handling the infection very well, and it's really so far very rare to see children or young adults have serious complications or any deaths related to it. But the risk of serious complication rises over age 65. And when we look at those people so far who have not survived, those who've died, the majority of them are over 80 years old. Now, of course, 80 years old means that often patients in that age range have multiple problems and complications. And so it may be confounded, that older age, confounded by other medical conditions that they have. We also know, as Shannon mentioned, that the risk is higher for people with chronic lung diseases, with diabetes, with other chronic diseases and heart disease. And as you know, of course, and as Shannon mentioned, chronic kidney disease is one of the chronic diseases. So patients on dialysis appear to be at higher risk than those who are not of higher complication rates. So what do you actually do about it? Well, the obvious is to avoid close contact with people who are sick. And so the efforts going around the country right now, which are unprecedented, we've never in our country before seen the kinds of steps for what are being called social isolation. That is, learning how to stay a distance away from people who are infected. One of the ways we know that infection spreads is when large number of people are in relatively small spaces. And so schools have always been a petri dish of spread of infections, and then children taking those infections back home and with their parents, and particularly with their grandparents, putting them at risk of more complicated disease. So it's important to avoid close contact with people who are sick. It's also good if you can remember to avoid touching your eyes, your nose, and your mouth, because that's the way you transmit the virus from your hands into your body. Stay home when you're sick, but come to dialysis. And as Shannon very, very nicely said, if you're feeling the symptoms of cough, trouble breathing, and or with fever, that is temperature that's over 100 to 101, you are at risk of having this infection. It's not terrible you have the infection, and likely you'll do fine with it. But call ahead to tell your dialysis unit that you're coming and that you have these symptoms, and they will give you directions on exactly what to do. Cover your cough or sneeze with a tissue and then throw that tissue in a plastic-lined trash container. Now, I usually walk around every day and I put my tissue back into my pocket after I have blown my nose. I'm learning not to do that now. I'm not sick now, but I think it's important not to do that. And also to clean and disinfect touched objects and surfaces. And you don't need anything special to do that. You can do that at home using regular household cleaning sprays or wipes. And the kind of surfaces are the ones that you know where people are around and where those droplets can settle out. And they include countertops, doorknobs, bathroom fixtures, toilets, phones like your iPhone, remote control devices, keyboards, tablets. These are the commonest places to think about each day, making sure that you disinfect and wipe down. Now, I want to say a few words about face masks. The CDC recommendation is that people who are well are not advised to wear face masks to prevent themselves from any respiratory infections like COVID-19. There is no science evidence that walking around in the streets or walking into spaces and wearing a mask is particularly helpful at preventing you from getting infection if you are healthy. Now, that's not true if you're in very close proximity to somebody you know is sick. Then it's important to wear a mask. I think masks, we should follow CDC advice and wear masks at times that either you're sick to prevent your spreading the infection to others, or if you're taking care of somebody who is sick and you're very close to them. The dialysis facility operators now are all talking about the best way to use all of this protective equipment, including masks. The important thing that we're talking to them about is that we're not in a sprint here. We may be in a bit of a marathon, and we may be talking about protecting ourselves this way, not for a few days or even a few weeks. It could be a few months. So we have to make sure we have enough of that protective equipment, not just for now and this week, but for the weeks and months ahead. Hand washing, probably the single most important thing that each of us can do. Best with soap and water for at least 20 seconds. You know, that happy birthday to you, say, sing that to yourself twice, and that's at least 20 seconds. And especially after you go to the bathroom and before eating and after blowing your nose or coughing and sneezing. Also, if soap and water are not readily available, you can use Purell-type hand mixes, alcohol-based sanitizers with at least 60% alcohol. Always wash with soap and water if the hands are visibly dirty. If you are sick, stay home except to get medical care, including dialysis. Separate yourselves from other people and animals in your home. Call ahead before you visit the doctor or the dialysis unit. If you're alone in the room, of course, there's no reason for you to wear a face mask. But if you're sick and there are other people who come into that room, please wear a face mask. Cover coughs and sneezes when you're not wearing that mask. Clean your hands often. Avoid sharing personal household items like dishes, glasses, cups, eating utensils, towels, or bedding with others if you're sick. Clean all those high-touch surfaces every day. Monitor your symptoms and talk to your doctor. And your doctor and your healthcare team will be talking directly and getting advice from the state and local health departments about when isolation should start and when isolation should end. If we take a step back and talk about how we think about this infection in terms of a public health perspective, the first thing that they talk about is containing the infection. And that's the step that we're in now, trying to identify individual cases and to contain the infection to prevent spreading. You've all heard the words on the news, the test kits. We don't have enough test kits yet. It's taken too long to distribute them out to health departments around the country and to other caregivers around the country. The CDC tells us that they are in the process now of distributing over 1 million of these test kits to state and local health departments with a goal of having commercial manufacturers add to that such that there are at least 4 million of these test kits distributed shortly. Containment buys time. It suppresses the number of infections and the peak of the number of those infections. But it also delays arrival of new infection to new areas. So it might have the effect of lengthening the time that we have to be vigilant about this infection. Once infections are clearly established in the community, and there are many of our communities now where the infections are clearly established, public health people move to the stage of mitigation, of working together with healthcare deliverers to make sure that all of the things that are necessary to keep people safe are in place. The supply chain of getting masks, gloves, gowns, alcohol gel to the healthcare providers and to us, to consumers and patients, is a critical issue that's being worked on now. Paying special attention to the needs of people in places like dialysis facilities. They've given us guidance on how to manage exposed healthcare personnel, and so that the nurses and doctors who take care of you will have very specific evidence-based guidance on when they should be able to work, when they go home, when they come back. And then guidance on when patients and healthcare personnel can be removed from isolation. One of the people on this chat asked about the policy that many dialysis units now are establishing of when they hear somebody that might be sick, sending them away, saying, no, no, don't come to the dialysis unit, go to the emergency room and get checked out first. And in communities in which there isn't a whole lot of infection yet, that's something that may be helpful. But I should share with you in communities where the virus is well established and the emergency rooms and hospitals are overburdened with people that need attention, particularly very sick people, not just people who have this upper respiratory infection, but people with complications who are very ill. When all of those people require hospital attention, it becomes impractical to say, oh, just go to the emergency room and don't come to the dialysis unit. And so dialysis facilities all are developing plans to safely care for patients who have symptoms suggesting COVID-19. And Shannon went over some of those with you before, which is If there's a private area or room that can be used to dialyze patients with infection, that's what will be done. If there is no private room, and if many patients in one dialysis area develop the infection, then units are working together to cohort those patients together and treat them together and a distance at least 6 feet from non-infected patients. And there are even some dialysis or corporations or areas that are thinking about whether to find shifts for only infected patients or even facilities for infected patients. All of these are being looked at very carefully by the dialysis owners at this time. Initially, special masks, instead of surgical masks, special masks called N95 fitted masks were recommended for use with this type of infection. And the truth is, if there were millions of N95 masks available, that probably still would be the recommendation if you're taking care of someone who has a clear infection with this disease. But there aren't that many around. And the regular surgical masks that will be used are nearly as effective, not quite, but nearly as effective as the N95s and will need to be used. So mitigation in communities, this social distancing is important. Staying home if you're sick, hand washing, covering sneezes. If you're home and ill, make sure you have enough food and medicine for weeks of care at home. If you're 65 or older or at high risk, you ought to think carefully about what actions you can take to reduce your exposure. I already mentioned all this, particularly avoiding crowds. So quickly, in summary, COVID-19 is a viral disease that spreads like the flu, but may spread a little more than the flu does. Most people who get infected through this illness get through it well with no long-term effects. People at higher risk include those over 65 and those with chronic diseases. To prevent catching the virus, wash hands frequently, clean surfaces, stay at least 6 feet away from people who appear sick. Hands carry the virus, so use fist or elbow bumps instead of handshakes. And prepare your home for possible self-quarantine with enough food, with enough medicine and supplies. Call ahead to alert your dialysis unit, contact your doctor, wear a face mask when in contact with others, and most important, keep calm. Most people with this disease do fine. So I will stop there and go ahead and see if you have questions that we can answer.
Thank you, Alan, and thank you, Shannon. This is Kathy. We appreciate all the information that you have shared with us. We have a number of questions in the chat box, and because of the large number of people on the call, we've been asked not to take phone calls, but you can send them to us, and we'll try to get some responses for you. Let me start by saying there were a couple of questions that asked about what about home dialysis patients and what about the risk for transplant recipients who are already on immunosuppressant drugs.
Yeah, so let me take a crack at that. First, for patients who have had kidney transplants and those who are on medicines to prevent rejection, those immunosuppressive medicines, yes, those patients are at higher risk of infection. So with that higher risk, those are people who should take particular care with all of those methods that Shannon and I spoke about to remain free of infected people. If you get an infection and you're on an get this infection and you're on an immunosuppressive medicine, you obviously need to make sure that your doctor knows that this is the medicine you're taking and that he or she works with the transplant group in order to help manage you most safely. Home dialysis is in many ways a blessing, right? Because you're home and you're not exposed to other people who might conceivably be carrying the infection. And the recommendations at home for a home dialysis patient are the same as the ones that we spoke about before, with hand washing and surface decontamination. Other than that, no other special, nothing else special to do. Either home dialysis or people at home, the question is, how careful should we be in who comes and visits us? And that's just a matter, obviously, of taking care in time of epidemic of identifying those people who might potentially be carrying infection and minimizing exposure to them.
Hi, this is Shannon. Yeah, I agree with everything Alan said. I think one thing for home patients, it might be a good idea, to start talking with your dialysis provider about, kind of your routine appointments, your scheduled check-in appointments that you come into the clinic for. I think it would be important for you to understand, what they want you to do before that appointment. For example, like if you're having symptoms, then maybe they want you to call ahead and let them know so that, you don't come in that day and potentially expose others. And, they may be thinking about some procedures such as doing, some televisits or telemedicine or stuff. So I think just kind of keeping those things in the back of your mind as well.
Okay, thank you. We've had some people who have asked questions about what to do if they observe a lack of health safety protocols that are not being observed in medical situations. We've also had people ask if they can share this presentation and the slides, and the answer to that part is yes, certainly you can. Do either or both of you have any thoughts for how, you mentioned earlier speaking up, but do you have any other thoughts for people on the call on what to do if they don't see good hand hygiene, et cetera, in practice?
Yeah, hi, this is Shannon. I think that's a great question as well. And I think I just reiterate what we said in the presentation about speaking up. I mean, I know it's easier said than done sometimes, but I think, we're all partners in this situation together, and I think we all owe it to our keeping ourselves safe, but also keeping, fellow patients and other staff members safe. And I know, staff members are going to feel the same way. Everyone's going to be stressed, and it might be very easy to forget things during this time. So I think, so maybe even as a patient, it could be time to start thinking about how you would speak up if you saw something. Some people are very comfortable doing it and others are not. So maybe even thinking through your mind, how you would do that and kind of what you think of as like an assertive but non-confrontational way as well. And I just was going to put a plug in. We actually have a video on our website that was recently posted, actually kind of about empowering patients to speak up. It's not specific to COVID-19, but I think a lot of the strategies in that video to think about how you can feel empowered to speak up can also apply. I don't know, Alan, if you have other thoughts.
No, let's go to another question.
Okay. There was also a question about potential transplant recipients. Should all potential donors be checked for the virus? And how will this affect transplant surgery? Will they be placed on hold, or what will be the approach going forward?
Yeah, so I'll do that one. So people on the list or people preparing for a transplant are mostly dialysis patients, and the cautions and the actions you should take are identical to every other dialysis patient. There's nothing different about that if you're on the list or if you're preparing for a transplant. Now, obviously, anyone who has the infection will not be transplanted. We only transplant people who are free of infection. So if people develop flu or this infection or any others, we wait until they're healthy and out of infection before we do the transplant. But it's an interesting question you asked about how this infection as an epidemic will affect the transplant world. And I think that's a good question that I'm not sure I know the answer to. As infection spreads like this, transplant centers may make choices to avoid potential complications, and I think we'll have to wait and see what they do.
Okay, thank you for that information. Anything else that either one of you would like to add at this point before we end our call?
No, just thank you guys for the opportunity to share this information. And again, you know, we'll continue to work with you to get any new information out and anything that we think of note that needs to be communicated. So we'll continue to do that on our part. And please let us know, you know, what questions you're getting and things that are coming up, because I think it will definitely help us inform our work here.
Yep, thank you.
Yes, great. Again, thank both of you, and we end at this point, but if we do get more questions, we certainly will share. With a feedback form, if people will complete that as they today, and please next month on April 30th for our next webinar. Again, bye-bye.